Thank you so much for being here. Really appreciate it. I look forward to this conversation and this discussion. We're going to be talking about water quality, we're going to be talking about rural health, and we're going to be talking about some of the impacts that we're seeing across the country and across the world, but also what are we potentially going to be, or what are we doing about it as well. So I'm going to kick it off, maybe. There we go. I'm going to kick it off to talk a little bit more broadly to kind of set the stage for the rest of our speakers today. And so I know that this is a pretty broad conference, so I'm going to keep the conversation kind of broad as well, because I think it would be important for everybody here. First off, public health. Public health, it helps promote and protect the health of people in the community. And so when we're talking about some of these issues, let's see, we have to put this in the lens. Oh, I stole my own thunder. We have to put this in the lens of how we can potentially use this information that we're gathering to actually do something at the ground level. And so just out of curiosity, and I kind of stole here a little bit, how many of you have heard of John Snow? How many of you have heard of this John Snow? And so a lot of times, and it depends on which audience I'm talking to, this John Snow is who people occasionally think of. But the one that I'm going to talk about is this John Snow. This John Snow is kind of one of the foundations of public health. He is, one of those people that kind of helped come up with some of the basic concepts and the basic concepts of epidemiology and how we can use information, gathering information to come up with creative solutions to very complex public health problems. This John Snow was a physician, and he was in London in the mid-1800s. This John Snow was a very curious individual that did a lot of really good, interesting things in his career. He's one of the reasons that we have anesthesia in medicine. He was one of the founders of that. Before that, medicine was a pretty brutal process, especially surgery was a pretty brutal process, but he realized that there were better opportunities to take in some of these anesthetics to potentially sedate the patient. But the other thing about John Snow is he was really good at observing patterns and observing processes and trying to come up with conclusions based off of creative and quantitative thinking. And the most famous case was the cholera outbreak that happened in London back in the mid-1800s. This particular outbreak caused a number of deaths, especially in the Soho region of London. There was periodic outbreaks of cholera, which we don't see anymore in London. And with this particular outbreak, John Snow looked at it, and he had been doing some investigation around cholera. At the time, they thought cholera was passed in the air. It was bad vapors that you were breathing in. But he was looking at it, and he was looking at the potential factors that was causing the spread of cholera, and when he looked at it, he said, I think it's water. I don't think it's air. And that went against the common medical thought at the time, and so people pushed back, and they were like, I think you're wrong. And one of his critics was this individual over here, Reverend Whitehead. Reverend Whitehead served that area of London. And he looked at it and he said, John, I think you're full of it. And he goes, and he got the thesis that John wrote. He read over it, he looked at it. And as he read over it and as he looked at it, he started to be more convinced. And he said, maybe we should look into this a little bit more closely. And so working with John Snow and some of the ideas that Snow had, they were actually able to go into the communities and start to identify the outbreak itself. And then there was mapping of the outbreak of the disease. And so each one of these little blocks here, this is actually where one of the original maps, but each one of these little blocks here, or ticks, indicates where there was a death associated with cholera. And so they were able to plot it out, and they also looked at distribution routes and where people were going, and they were able to pinpoint that there was a pump at the middle of this, and that the pump was the potential cause of the outbreak. And then there was complexity with it. They took the handle off, people wanted the handle back on. There was all sorts of political issues that arose from it. But the reason that I bring that story up is because, one, it's related to water quality. Two, it's related to the complexity of a lot of these issues. And it shows the use of patterns in identifying disease associated with the environment. And then it also talks about how some of these challenges extend beyond the causes of the health issue, because there was like the removal of the handle pump and all the political issues within the community as well. But it also highlighted the importance of local champions in addressing these issues. If it wasn't for Reverend Whitehead, we wouldn't even remember John Snow, because actually his thesis was lost in history, and it wasn't, and he passed away, unfortunately, I think in his 40s, and it was Reverend Whitehead that, when we actually understood germ theory and some of these other things, said, you know what, there was a guy not too long ago that was actually looking at some of these issues. But Reverend Whitehead was also that local champion that happened within the community. And then the other piece of it is perseverance is key. And so when we talk about public health, we work on all variety of different things to better improve our community, our society, and the health of the individuals living in there. We help educate the public, enhance monitoring, contributing to public dialogue and research. And what you're going to see today is 4 examples of just those 4 things. But we don't spend a lot on public health. Oops. Let's see. So rural populations are particularly susceptible. They are a community that is at risk to environmental justice issues, remote and rural populations. Rural populations have higher rates of uninsurance than urban areas. They have healthcare shortages, and they're especially prevalent in rural areas. There's a lack of specialty care, and so if issues do arise, individuals usually have to go quite a ways. And then there's transportation and access issues to care as well, because it can take hours to potentially get to a hospital or medical facility, depending on where you live. And then there's also socioeconomic issues in rural areas. There are higher rates of low to moderate income, less likely to have employer-based insurance, more likely to be on Medicaid, and compared to urban areas, they're more likely to be unemployed, less secondary education, and lower median household income as well. And then there's a variety of infrastructural issues in rural areas. And you're going to learn about some of those. And so, in overview, Nebraska and a lot of places have issues with water quality. And so we need to understand what are those issues and how they're potentially related back to human health. And so some of the goals that we have within our program and the goals of the individuals here is identifying at-risk areas and people that are at risk as well to water quality issues that could potentially cause human health issues. We need to make sure that we're encouraging testing of water, because if you're on a private well, that's your responsibility to test that water. That water falls outside the Safe Drinking Water Act and the Safe Drinking Water Standards, so it's on the individual themselves. And then we need to find low-cost to no-cost solutions to addressing water quality issues so that the burden doesn't fall on the individual that owns that home. And then we need to make sure that we maintain these systems as well. And so the Water, Climate, and Health Program, which a number of individuals up here are associated with it, and actually everybody up here is associated with it in some way, helps with pioneering some of these interdisciplinary solutions around research, education, and collaboration in addressing some of these public health challenges associated with water and water quality here in Nebraska and also around the world. And we do that through research, education, engagement, and policy development. And we have a variety of different individuals that are working in this area, from myself to Dr. Rogan, to Rachel Luckadoo, who's in the audience, and Christina Kitzinger, and Laura and City as well. Alan's on our advisory panel. And so, in summary, we need research to understand some of these patterns. We need to address and look into some of these relationships more closely. We need to build collaboration, especially with the agricultural sector and community, to address these issues, because we can't do this in a silo in any way. And then we need to make sure that we're working on educating the public on water testing and identifying mitigation options and addressing these issues as well. And so with that, if you're interested in our program, feel free to check it out. And I will, should we take questions in the interim? Or we're going? Yeah. All right, well, how do I get to the next slide? Oh, sorry, I guess that's. Yeah.
Okay. Thanks, Jesse. How am I going to know if this is working? Well, I'm going to hope it's working. It's not. No, we don't have the mic on in the room because it was discovered in the morning you get a terrible echo if you do that. But hopefully it's working for the people online. So anyway, I would like to move on to my presentation. I'm Ellie Rogan, for those of you that don't know me. And it doesn't say that yet. There's going to be a little gap. As Jesse said, I'm part of the Water, Climate, and Health program. And for quite a number of years now, probably close to 10 years now, we've been investigating water-related health issues throughout Nebraska. And particularly today, I'm going to talk to you about, oops, it's got the wrong title. It really should be nitrates and pediatric cancer. I didn't catch that. Anyway, I'm not going to talk about atrazine today. What I'm showing you here is these are data that are showing the age-adjusted incidence rates of pediatric cancer, childhood pediatric cancer in the United States. And you can see Nebraska there in dark blue. It stands out in the Midwest as it has in that particular year for whichever year this particular one is. It's the 7th highest incidence in the United States of pediatric cancers in general. And we've been trying to discover why that is. Asking the question is, do waterborne agrochemicals have a relationship to this high incidence of pediatric cancer? In other words, the agrochemicals that end up in our waterways or in groundwater, are they contributing to this high incidence of pediatric cancer? Here's a map of pediatric cancers in Nebraska, and it's among the 5, well, in this, anyway, you can see that in the different parts of the state, and what you can see is that the areas in red there have the highest incidence, and that's on the top. And then on the bottom is another map showing just pediatric brain and other central nervous system tumors. So you can see there are areas in the state with high incidence and areas in the state that have lower incidence. And we wanted to understand, among other things, why that is. And does that, again, relate back to agrochemicals that have ended up in waterways. In particular, I'm going to talk to you about nitrates. So you get nitrate in the water, primarily from fertilizers, also from animal and human waste. The regulatory limit set by the EPA is, as nitrate, is 10 milligrams per liter of water. That is set because at that level you won't get blue baby syndrome, which that comes from an acute exposure to nitrate in the water. That's one of the reasons for that. Okay, all right. Well, the pink ones are the pink watersheds are the ones where the incidence is higher than the national average, and the green ones are ones where they're lower than the below the national average. So you can see there are a lot of more than half of Nebraska shows incidence of pediatric brain tumors above the national average. Now, if you look, the map B is for leukemia. The map C is for lymphomas, childhood lymphomas, and you see again there are areas where you have higher, the significant areas where you have higher than the national average incidence of pediatric lymphoma. So we wanted to see, we thought we would compare that to a map of what kind of crops are grown in Nebraska. And we had hoped originally we would find a statistically significant relationship here, but I have to tell you we did not, just on these particular areas. However, in the eastern portion particularly, you see the green and black dots, and those are where corn are grown. A statistical agreement here. You can see that overlaps a lot with all the areas where the levels of brain tumors are, the incidence is higher than in other parts of the state. So I think there may well be a relationship there, although we have not yet managed to demonstrate that. All right, so here's just the statistics on that to show that the incidence of brain and other CNS tumors, which make up more than a quarter of all the pediatric cancers in Nebraska, are significantly higher than the national average. So it's really brain and other CNS tumors that are driving this high incidence of pediatric tumors in Nebraska. Here again is a map. We were back to overlay these maps. You can see that a lot of the areas where the pediatric brain cancer is, we're continuing to look at this. The data, these data, the mean concentrations of groundwater, of nitrate in groundwater, they came from national databases or state databases of water data from the U.S. Geological Survey or the EPA or the Nebraska Department of Energy and Environment has their so-called clearinghouse, which has data also on this. We gathered all of those data together. I didn't want to take the time to show you those data. The problem with them is there are gaps, both geographically there are some gaps, and there also are temporal gaps where they'll measure the water in certain locations year after year after year, and then they don't do it again for 5 years or something. So that wasn't terribly satisfying. So what we've started doing more recently is we decided we would focus on a couple of watersheds where we knew there were high levels of nitrates and high levels of pediatric cancer, and gather water data ourselves. We've had very nice cooperation from the natural resource districts in helping us to gather water, get water samples, and then we've been analyzing them. Even though, and we think this makes sense as a way to proceed because the land in Nebraska, the rural land in Nebraska, pretty much the usage has stayed the same for a long time. So we figured this was a good approximation for us to continue on and to try to see if we can draw any more detailed conclusions. So we're as two areas where we know that the levels of cancer, pediatric cancers, are high, and we also know that there are high levels of nitrate in the water, and I don't have any more detailed data to show you about those. But that's where we're going with this study, and I clearly uploaded the wrong thing here. So anyway, I think, so what could you do about that? Because our interest is in not only finding out where the problem might be, but how could you handle, what could you do about this problem? There are two things we think that could happen. We actually think from, not just from our data, but from the other data that I've showed you, these other studies, that EPA should really lower the level of water that's permissible from 10 down to something lower than that, because people are seeing even at lower levels of nitrate. We realize, I want to point out, we realize that this could make for a lot of economic problems out in the state, in the small towns that need to have water that meets these legal limits for contaminants, because all of purifying the water is very is expensive, and if we lower the limits, it's going to raise those towns' cost of doing this. The other thing is, we really think it would be a lot better if private wells in Nebraska were regulated and tested, and in order to do that, again, we think the state provides funds to do this. And I do know that there are programs in at least limited parts of the state, for example, in the Northeast, in part of the state in the Brazil area, where they do give funds to people to test their wells, and to people on farms where they have private wells to test their wells, and also to purchase a reverse osmosis unit, for example, if they need that to have safe water to drink. Those are the kinds of programs that we think would be beneficial all over the state. So we have found a positive association between nitrate levels and three major types of pediatric cancers in Nebraska, and we do think that policy changes could reduce this problem so that we didn't have one of the highest incidences of pediatric cancer in the United States. With that, I'll stop, and I will turn the microphone over to, I'll turn the clicker over to Al.
Thanks, Ellie. Do I have to do anything up there? While Ellie's turning that off, I'd just like to say hello to everybody, and I'd like to thank specifically Jesse. You can see by I'm trying to be small, which for me is hard, and get out of everyone's way. There, how's that? I'm going to talk about pesticide mixtures and health in the Western United States, but I wanted to also talk about this idea of the session and how can investing water-related health issues help rural America. And I wanted to address that literally head on. So, all right, so does rural America need help? And the answer there is, yeah, they do. And this is an example out of a relatively recent example out of, as you can see here, your favorite newspaper, the Oregon Capital Chronologue. And what happened there was in Morrow County. Not many of you know where Morrow County is. I didn't either before I started doing this, but Morrow County, and I actually got the brand name wrong. It's not Chobani, it's Tillamook. Tillamook ice cream, the cows, they live in Morrow County. They don't live out on the coast where on Highway 101, those cows, those aren't the cows. There's 10 times more cows in Morrow County, which is in the eastern part of the state. All those cows, indelicately, they poop. And that poop and the urine from those cows has infiltrated the groundwater and has caused issues very consistent to what Ellie was just talking about, in that water samples have high nitrate levels. Remember, Ellie was talking about a discriminatory concentration of 10 mgs per liter. In Morrow County, we're talking about anywhere between 29 to 48 parts per million, up to nearly 5 times the federal safe limit. This is a town that's equivalent to rural western Nebraska, in that there's maybe 40,000 people that live in this county, the entire county. Tiny county, more cows than there are people. They don't have the infrastructure to handle this. They need help. They definitely need help. So what do they, and now I'm leaving the issue of Morrow County, and I'm just asking from a general sense. Okay, if we recognize, relative to what Ellie said, relative to what Siddi's going to talk about in a few minutes as well, what do they need help with? Well, one thing they need help with, as you've already seen from Ellie, you've already seen from Morrow County, Siddi's going to talk about this relative to some really interesting citizen science work. They need help relative to what I would call the usual suspects. Who are the usual suspects? Nitrates, right? You see that in a lot of other places. What other usual suspects do you see? In this case, compounds, things like elemental arsenic, right? If you were to look worldwide and ask what are global primary contaminants of water quality that influence people, these two are absolutely on the short list of the usual suspects for the issues, right? So these things, rural communities definitely need help here if they're exceeding safe limits. That's well established. What else do they need help with? How about this one, right? PFAS, the chemical of emerging concern of the decade. I came up with that. It's not really from anywhere. I just thought it was cute. But EPA just recently releases 4 stringent health advisories for PFAS in drinking water, NACWA to help prepare members relative to any questions. As if you're familiar with PFAS at all, you know that it's going to present analytical problems because of this, right? And the fact that one specific fluoroalkylated substance, PFOA, 4 parts per quadrillion, picograms per liter is what is the advisory level. Parts per quadrillion. That is the world's driest martini, right? I mean, that is just down there. PFAS, perfluorooctanoyl sulfonic acid, 20 parts per quadrillion. We're talking about chemicals in astonishingly low levels, right? And if you compare that to mgs per liter, which Ellie and I and Siddi deal with relative to nitrates, these are much, much lower compounds. However, the one thing that they all share, right, PFAS, nitrates, arsenic, they're not going anywhere. They're not going to change into anything else. That's both the good news and bad news about PFAS. The bad news is it's a forever compound. It's not going anywhere. The good news is it's a forever compound. It's not going anywhere. So once you develop the analytical capacity to measure it, which has, incidentally, shameless plug, there's very good analytical capability. I found this out at lunchtime here at the University of Nebraska at the Analytical Sciences Laboratory. So if you have a PFAS problem, contact Dan Snow. He can do this for you. Tell him Alan sent you. I get a kickback on that. So, but seriously, it's going to be there. You can measure it. Believe it or not, that's the good news. Here's the bad news. This book, the book book's not the bad news, but this book just recently came out by Jerry LeBlanc out of North Carolina State. He wrote this book, Everyday Chemicals. He's a long-standing, long-in-the-tooth, aging, decrepit, kind of like me, aging, decrepit ecotoxicologist. He's had his, like me, he's had his better days. He's written this great book, though, and in this book there is this quote: "Those chemicals that pose the greatest danger to human health are designed to have specific modes of biologic action. They tend to be high risk because by design, they elicit effects at low levels that we may be exposed to in our daily lives." So what are we talking about? Are we talking about arsenic? Are we talking about nitrates? Are we talking about PFAS? No. We're talking about these. Again, the usual suspects, but we're talking about these. Farms, right? Pharmaceuticals, and pesticides, which is why I'm here. So let's talk about pesticides. So for the rest of the talk, I'd like to talk about, now switch gears and talk about what the actual title of my talk was, and pesticides in the United States and their relationship to public health. Now, relative to what Jesse was saying before, he brought up John Snow, and he brought up this idea about geospatially monitoring pesticides. And that, or excuse me, not pesticides, but chemicals, and then relating those, or biologicals in the case of John Snow, and then relating those to public health. Classic geospatial epidemiology, great stuff, really good. Does it work with pesticides? No. And the reason it doesn't work with pesticides is this. Pesticides create some real serious environmental monitoring problems. And if you don't have the environmental monitoring, if you don't know what you're dealing with, how can you know what kind of effect it has on public health? So here are some of the problems, and you can read them, but I'll read them for you. Multiple chemicals are often used simultaneously, right? Each chemical has its own fate and transport in the environment. So where atrazine may move into the groundwater, let's just say relatively easily, something like glyphosate may not, right? So the fate transport can be very, very different. So you may be capturing one chemical and not capturing something else. Each chemical might lead to a different adverse health outcome. And latency periods, again, what Jesse if you went to the talk this morning in drought, Jesse was talking about issues relative to drought have both acute issues and then there are chronic issues, and the chronic issues can happen days, weeks, months after the drought event. Well, with pesticides, as Ellie was alluded to relative to cancer, we can be talking about years, even decades after exposure that adverse impacts could potentially occur. And as Ellie also said, those relationships are really difficult to epidemiologically deal with, and their correlations. Now, before, one of the mantras, right? All of my students use it, everybody use it. Correlation is not causation. Totally true. But go back and tell that to John Snow. Because what did he do in the vicinity of the Broad Street pump? That was a correlation, right? I mean, he looked and said, oh, wow, look, all these things are correlated around the pump. Just because it's a correlation doesn't mean it's valueless. It does mean that it's not causative, but those are two different things. I'll come back to that point at the end. All right, so now the question. We've got, whoops, I'm sorry, that should have been backwards. Hold on, but we'll go, okay, here. We have the CDC. The CDC has registries that are massive, that are deep, that are well established relative to adverse health outcomes, things like cancer registries, right? However, there's a divide because the USGS doesn't have the money, big surprise, that the CDC has, so they don't have the infrastructure to be able to match, let's say, pesticide concentration in water nationwide in every county in the United States or every district or whatever else. They just don't have the money to do that. So there's a divide, right? We'd really like to know this relationship, but you can make an argument that CDC data, rich, pesticide fate transport on a nationwide level, poor. That's a problem. So with that, you could say, okay, well, let's not worry about that. Maybe pesticide concentration is just consistent over the entire United States. Well, you live in cow country. You know that's not true, right? And many of you have seen this map. This is the map between animal feed and human food. They're not grown in the same place. You guys here in Iowa, Nebraska, Illinois, Indiana, Ohio, You're growing animal feed. There's nothing wrong with that. Animals need to eat. That's totally fine. But look at California, Washington, Oregon, Idaho, Montana. They're growing peaches and all the stuff that you go to the grocery store and buy. That's where it's coming from. You think they use the same suite of pesticides? Probably not. Well, how are we going to get any data on that? How are we going to show that on a national level? Well, fortunately, here's the good news. I'll come back with the bad news later on. But here's the good news is that the USGS through NAQUA has a database that has over, as it says here, over 475 different pesticides by county from 1992 to 2017. And if you're interested and if you don't have time to write that down, let me know. I'll give you my business card. I'll be happy to share that with you, as well as our papers that we've done relative to this. So there is a database. Now, this isn't occurrence in the environment. This is usage. This is how much farmers have bought, right? So generating an exposure, admittedly, is a bit tenuous, but this is a pretty robust database, at least it has been, and we'll come back and talk about that in a moment. But so these data are available. Can we do anything with it? We started to ask that question. My postdoc and I started to ask that question about, what, Ellie, 4 years ago? Can we do anything interesting with these data? Remember what I said before about animal feed versus human food. You don't have to come to Nebraska. If you live in Idaho, you don't have to come all the way to Nebraska. You just have to go to Montana to see that. So in this slide, if you look at the map, what this map is showing is the far western states, Oregon, Washington, Idaho, Nevada, California, in dark purple. I guess that's purple or something. And then in the pink are the western plain states. And look at the pesticides. The pesticides are fundamentally different. And and just to do it real quickly, the 5 bars on the left are the far eastern states within the western United States. Those states are all herbicide dominated. The use in those states is herbicide dominated. Then you look at the far west. It's not herbicides. That's not the pesticide class of choice. The pesticide class of choice is fumigants, because they're growing food and they need to keep that food from becoming moldy and mildew and everything else. So they're using fumigants on those crops. So they have a fundamental different pesticide load across the western United States. Wow, that's really interesting. Now, is it earth-shattering? No. And you could have, from the previous food versus feed map, you could have guessed that. But the beauty of the USGS data is it allows us to empirically demonstrate it. How totally cool that is, right? I mean, that's really interesting. Now, there is a graduate student in the audience, and I'm not going to point her out because she would be embarrassed, but there is a graduate student at the Med Center that is looking at taking this approach and doing it entirely nationwide. Maine to Florida to California to Washington, right? The entire contiguous 48 United States, and asking how those different profiles across the state of pesticide use influence potential adverse outcome relative to the pesticide use that the rural communities are being exposed to. I think that's really exciting. Let me show you a little bit more relative to the western United States. And this is just, admittedly, linear regression kind of stuff that you could do as a sophomore in a statistics class at an undergraduate school, right? So you're just a regression between pediatric cancer incidence and fumigant mass. And again, the states on the far eastern side of the western United States, really low fumigant mass. The food growing states, much higher. And there's a correlation. There's a statistical correlation. Now, is it causation? Of course it isn't. Is it something that you should, like run out and freak out and tell all the newspapers? Of course not. It's not. But it's valuable from the perspective that it's telling you something. It may not be telling you the full. It's certainly not telling you the full story, but it's telling you something. My postdoc took these data, and I'm going to do this relatively quickly. And he asked the question using principal component analysis. He asked the question of, can we take that simple 11-state approach, do the same thing over the 11 states, but do it by county? And instead of looking at different classes, we're going to look at the top 25 pesticides used and do a principal component. So kind of mush them together into principal components and ask the question. And I'm not going to go into the statistics, but what he did was he compared the observed all cancer incidents across the United States, which is the map on the left, to what could be modeled through this principal component analysis. And you can see that the two are really, really close to each other. See, okay, so what about these principal components? What's going on? So multivariable approaches explain this association of several pesticides to cancer incidence. Fumigants, again, on a county by county level, are again statistically significantly associated with both total cancer incidence and pediatric cancer incidence. That's kind of interesting. And one fumigant in particular, the fumigant Matam, was significantly associated with incidence of pediatric cancer at both the state and the county spatial resolutions. Now, I just want to throw out a shameless plug to one of the most brilliant people that I know, and that's Dr. Don Coulter at the University of Nebraska Medical Center. He's a pediatric oncologist. So, and the reason I'm bringing him up is you might wonder, why would this be important? Okay, Kolak, you said that this is just, it's correlation, it's not causation. So who cares? And if children have cancer, you're going to say, gee, I have a correlation. Try to explain that to a parent. Like, how does that benefit the parent of a child with cancer? The way it benefits a parent who has a child with cancer is you can do things such as say, if you're going to enhance the public health of rural communities by doing something like putting in a rural oncology clinic into the environment, where do you put it? Well, maybe using a map like this helps give you some information where putting a clinic may be more valuable than other places in putting the clinic, right? Does it solve the question of course it doesn't. Does it help those grieving parents or help those poor kids? Maybe it doesn't, but the fact that they don't now have to drive 3.5 hours to Omaha, but they only have to drive 45 minutes or 30 minutes, so the father doesn't have to lose his job. And I'm not saying these things, and I'm not trying to throw Dr. Coulter under the bus. I'm not saying this. Dr. Coulter was saying this. Like, it matters if you're going to have a rural clinic. It matters where you put that clinic because it can literally hold families with children with pediatric cancer together during these really, really, really tough times. So even though it's only a correlation, these correlations can be significant relative to the health and well-being of the rural community. Boy, that even pulled at my heartstrings there. That was so thank you very much. I appreciate it. Do I need to turn this one? No.
At UNMC College of Public Health as data analyst, and also I am a PhD student in the department in College of Public Health. Today I'm going to talk about citizen science as a tool for monitoring water quality in Nebraska. So I want to start with the water quality, global water quality challenges leading up to the water quality monitoring and citizen science. So what are the general water quality challenges? 1 in 9 people worldwide use drinking water from unimproved and unstable sources. 2.5 billion people live without any form of sanitation. 90% of sewage in mainly developing countries is discharged untreated and directly into the water bodies like rivers and lakes. A reduction in 1/3 of global biodiversity is estimated to be a consequence of degradation of freshwater ecosystems due to the polluted water and the sewage that is discharged into the water. Sorry. I'm sorry, I think it's skipping. And what are the specific water quality challenges that we see in Nebraska? As we saw from Dr. Kerlock's presentation, herbicide in Nebraska, herbicide atrazine is the most widely applied pesticide historically since the 1980s, as corn is one of the major crops that is grown in Nebraska. Then we have a lot of cattle in the sandhills, so antibiotics from animal waste is one of the sources for water contamination and water quality issue in Nebraska. And then we have nutrients such as nitrates from fertilizers that are applied to the agriculture as one of the sources of high nitrate issues that we currently are facing in Nebraska. So how do we measure these nutrients? Majorly, it's all over United States. The communities that are surrounded by agricultural activities, there is a potential for contamination of water from manure, fertilizer, and pesticide applications. Nitrate and phosphates are the nutrients that are needed for growth for the plants, but excess use of these fertilizers has led to an increase nutrients into the soil and the groundwater, causing adverse impacts. Good water quality is there, however, necessary for public health applications, for public health. So how do we what is the relation between nutrients and the water? Nitrate and phosphate are present in water. From the chemical, we see the picture which shows us the cycle of the agricultural activities, the daily industrial activities, which leads up to the contamination in water. The excessive nutrients from agricultural and industrial waste run off into the streams and lakes and ponds during precipitation and rainfall season, and it further carries this rain carries the nutrients into the groundwater, contaminating the aquifers. This is a map we see of nitrate that is in Nebraska. It is the groundwater nitrate measured from NDEE. These are the samples that are regularly, not regularly collected by NDEE, sampled. So if we look at the map, the median, we see a lot of higher concentration in northeastern Nebraska. We see a lot of, in gray, missing data. And this is one of the challenges about water sampling. It's anywhere in the world, because it's really expensive, and we do not get a consistent spatio-temporal coverage for water sampling from any water sampling agencies. And that's where we see the citizen science being as one of the tools to bridge the gap or for monitoring water quality. We know that water quality is important for public health. So nitrates and, sorry, I think I'm good. So why are we monitoring water quality in citizen science? The goal of the citizen science is to measure the levels of nutrients that are present in either well water, rivers, streams that are in Nebraska. So the reason why we are testing the private wells is to give an opportunity for the farm families to improve their health by identifying potential contaminations in their drinking water, that is from the private wells specifically, or for any of these nutrients. And this program that we have for citizen science is not affiliated or by any regulatory bodies or the US EPA. We started this program in 2018 at UNL. We wanted to measure mainly nitrate concentration in private wells or surface water, that is either from lakes, ponds, depending on the participants in eastern Nebraska, but then it moved on to any parts of the state. And the test kits were provided to the participants during two times in a year, one in May and September. And the training for testing the water was given either in person, or YouTube videos were uploaded for them for measuring the water quality. This is an example of the at-home sampling kit that was distributed for measuring nitrate and nitrite. So it consists of a test strip which indicates with indicators for the level for nitrites and nitrates. You take, so the participants have to submerge the strip in water for 1 second, then hold the strip for 60 seconds, and then compare the color with the measurements that we see on the strip, and then record the results matching the colors and for the respective contaminants. Similarly, we measure phosphate. We have a separate strip for phosphate, which has to be submerged for 5 seconds and hold the strip for 45 seconds. Compare the respective color from the test strip to the marked code, and we record the respective result or measurements for phosphate. Then these results are uploaded to the UNL website, and we create a database of all the measurements. This is the dashboard that was created for the data that we have collected since 2018. We see that a lot of our participants were from eastern Nebraska, from north and south, and a few from Scott Bluff. Measurements, and it does show us that every single record has variation for nitrates and nitrites. The time series that we see on the right is for nitrate, nitrite, and phosphate. Majority of the nitrite results that we see is below the MCL, even for nitrate, except a few wells or samples in 2020. There is no MCL that is defined for phosphate. But we do have these individual records for the data since 2018, and it's an ongoing program that we currently have. The future work for this project is we want to use citizen science data to fill in the spatiotemporal gaps in the historical water sampling that has been done by various agencies like NDEE or USGS monitoring wells. So we need more research. Exactly what are there are challenges for merging the data, for comparing the data from the private wells and the monitoring wells, and that is something that we would like to use this and look at in future. And further, also looking at the ways to understand the health implications from the citizen science data. I think the citizen science data gives us a very closer real data information about specifically about the location where monitoring wells do not exist and water is not sampled regularly. So I think so that is something that we plan to do with the citizen science data in future. Our team, I would like to mention Dr. Shannon Bodley-Hunt at UNL, Dr. Jessie Bell, and me. We are currently the team that's working on this, and we have a few postdocs before. Yeah, thank you.
Introduce myself. I'm Laura Negengast. I'm the Source Water Protection Extension Educator out of the University of Nebraska. As well, I work with UNMC and the Nebraska Department of Environment and Energy. And today I'm going to talk to you all about how do we engage with Nebraska citizens or Nebraskans about these topics that my colleagues just talked about. So what are we doing on the ground with real people currently in Nebraska? So just to give a little context of the angle I'm coming from is I work for Nebraska Extension, and so we are housed in the Institute of Agriculture and Natural Resource. And the purpose of Extension, so there are teaching faculty, there are research faculty, and then there are extension faculty. And so the extension folks are, their purpose is to kind of bridge the gap of what's going on at the university, what's going on with the research, and get into communities and work hands-on. So there are extension folks across the state that all do different types of work, and my focus is on the water quality and health aspect of it all. So I want to start off by talking about what's the conversation, what are folks thinking about water quality and health currently in Nebraska? And so we know that nitrate leaching into the groundwater is not something new. We've been talking about this for decades. There's been ongoing conversations about how can we be more efficient with our nitrogen use, our nitrogen fertilizer use, sorry. So the farmers, producers, agronomists all have been talking about it. But lately things have changed, and a lot of it is due to what my colleagues, different types of researchers have been doing and producing, the research they've been producing. And it's been in the news, the health impacts, it's been in the newspapers, on TVs. We've been asked to speak at a number of different conferences and panels. People want to know about it. And that is because health is personal. You know, my grandfather died of non-Hodgkin's lymphoma, and that was one of the potential cancers that are associated. And so did his next door neighbor, and they're both from Northeast Nebraska, where we see high rates of nitrate. And I'm sure a lot of other folks can tell similar stories. And so when we're talking about human health, it hits differently than just the financial aspects of nitrogen fertilizer use and so on. And one of the main ways we see this being looked at differently is the funding that is coming out of it and what's been going on, the funding that's been produced and being taken advantage of in Nebraska. So my position as a source water protection extension educator is really the first position in Nebraska that's been solely focused on educating folks on water quality and health, protecting your drinking water in terms of protecting your human health. But that was only 1 year ago. But since that, we have been involved. I've been asked to be on search committees, been asked, how did you get funding for your position? Folks are interested in hiring similar positions. Different agencies across Nebraska are interested in hiring positions to educate their respective communities on water quality and health. So it's becoming something that a lot of people, a lot of agencies are noticing is important to spread awareness about. We also can see the different grant opportunities, funding availability for research and different things regarding water quality and health. This is a grant that we haven't started working on. I didn't write the grant, but I will help out with it. Educating Women on Human Risk of Groundwater Contamination grant. So it's really cool. It's solely focused on educating women on groundwater contamination and the potential health impacts that it can have. And then the last 3 bullet points, I'm going to get into in a little more depth in the next slides, but we'll talk about the reverse osmosis systems funding Nebraska has, and then the Citizenship Water Quality Curriculum Project, as well as other educational resources that we're developing. So in case you are not aware, in 2021, some funding went through the legislature that focused, its sole purpose was to provide rural folks drinking off of private wells access to reverse osmosis systems. So reverse osmosis systems are what you can put on your drinking water, like the faucet, to reduce the nitrate levels of your drinking water. And so generally, it's a little complicated, the whole application process and everything, but the goal is you test your well. If it tests high in nitrate, your private well, if it tests high in nitrate, you can send it into the the state and along with the application. And then if it's high enough, there's a ranking system. If it's high enough, you can qualify for a rebate program. So they'll give you back up to $4,000. And so how I kind of played my role in this whole thing was to talk to community leaders or people who have influence in parts of Nebraska, in the rural parts of Nebraska, to tell them about this program and disseminate that information down. And so we held an in-service. We had many attendees. We've gotten great applications coming in for this funding, which is exciting. Another thing briefly is the water quality curriculum development going on with UNMC. I think Dr. Bell is involved in this. It's Taylor Hamblin from the University of Nebraska. He's a PhD candidate, and he is working on these lessons. There's a social studies lesson and then a science lesson, and both have to do with water quality. They're similar, but also different. The water quality, we can talk about the history of it, the science of how do fertilizers move through water, how does that go through the vadostone and into the vadostone, through the soil, into the groundwater table. But we're exposing kids, students in high school at earlier ages to what is water quality, what's the importance of it. And so this is a really exciting project. It's being piloted across all of Nebraska. It's nothing that's like a permanent lesson course yet, but it's an opportunity. It's something we've never had before in Nebraska. Additionally, we've been able to have funding to create different types of educational resources. So Nebraska Waves is a watershed aquifer virtual education system. They produce little 5-minute videos talking about different things to do with water. UNMC's Water Climate Health Program, Dr. Bell, Dr. Rogan, I think as well, helped create this one, specifically focused on the impacts of human health. It's up on YouTube. A lot of different people have asked to use it and get like the MP4 file of it for their PowerPoints, things like that. The views have been great as well, so that's an avenue we also haven't had before. And then also creating, this is just another example, creating different like hard copy materials, handouts, getting them translated into a languages we need here in Nebraska, being able to listen to communities and being able to listen to their asks and provide them with what they want. Something I have been interested in and really trying to promote is hosting meetings and more peer-to-peer learning. Thanks, Rachel, for the photo, and then Crystal Houston for the other photo. But this is from an event that I held in York, Nebraska, which is not too far from here, a couple weeks, maybe like a month ago, maybe 2 months ago. But in the morning session, we had like education. Some speakers come to talk to anyone who wanted to come. There were water operators, which are like people who work for cities. There were producers there. There were natural resource district staff, a number of different people. And we had like some education in the morning, and then in the afternoon, we went out to a field. And so this man in the white, he is a farmer, and he farms the land, that field behind. He farms the land that is above the water that the city uses to drink. And so he talked to the farmers, the different people there, about what does he do as a farmer to increase the soil health and how that impacts the water quality. So there was great opportunity for folks to, instead of someone like me who is not a farmer and a young woman in academia, can learn from someone who looks like them, does the same work, that type of thing. So it was a really good opportunity. I hope to do more things like that in the future. And how much time do I have? Is it 4? Well, 4:15. Oh, okay. Okay, so like 5 minutes. Okay, so I want to end the rest of, or just like the second half of it, talk about the future. So one of the biggest things we want to do right away is expand our current audience. So right now we're working with producers, trying to expand in some ways, but these are the folks that we're really, really interested in hitting. Women, as we know, they make over 80% of the healthcare decisions for the family. So when we're really trying to talk about the health impacts, women will play a large role in what's the health of the family. What are they going to do to protect the health of the family? We also want to work with healthcare providers and public health departments, as they are typically trusted sources of information and can disseminate information through their avenues. They're placed obviously across the state as well. And then youth, as we're doing with the curriculum project, or Taylor's doing with the curriculum project, reaching the next generation, whether that's water quality, but also potentially different farming practices and ways we protect soil health, so that aspect as well. And then the last three, research, funding, and policy. We're doing great research. There's so many great researchers, my colleagues, fantastic scientists, but there's always more research that can be done and is being done. Securing more funding for different events, different things, different grants, different research projects, and then policy. That's a difficult topic sometimes in Nebraska when we're talking about nitrogen and nitrate and fertilizer use, and how Dr. Rogan mentioned potentially lowering the drinking water limit. It's a touchy subject, but it is something that we need to be talking about. Just because it's difficult shouldn't mean that we're not discussing it. So kind of to close, I want to end this on an optimistic note. Sometimes the health stuff can get a little negative, but we have the attention of folks, we have the attention of the media, we have the research that we've never really had before. People are interested, and we really have the opportunity for a real impact here. And that's what keeps me motivated in my job, is that there's a real opportunity for change in this realm. And so I'll leave you guys with this quote, kind of wrap up the session with it, from Wes Jackson, who is a big part of the agricultural sustainability movement. Maybe you've heard of it, maybe you think it's cheesy. But I think it's really relevant to what we're doing, what you do when you're part of big research projects and big research questions. But he said, if your life's work can be accomplished in your lifetime, then you're not thinking big enough. So thanks for listening to our session today, and we'll answer some questions.
So now we're going to transition into the Q&A session, part of the session. One, I was just going to open it up to the audience if you had any questions for our panelists. And, go ahead, please.
I guess I have a question for Dr. Rogan. The nitrate limit, 10 milligrams per liter, was established by basically after the work of a country doctor in Iowa about 75 years ago. And since then, we haven't managed to look at it more seriously. So I agree fully that that limit needs to be looked at and possibly changed. But I'm curious, how did you arrive at the, if you could elaborate some more, that 3 milligram per liter that you recommended?
I got the 3 is not a solid, it's not out of some great science that we did. I took the 3 from reading the papers that I didn't list all the papers there, but the papers that have shown that that other studies were still seeing health effects with people consuming water with nitrate at lower levels than the 10 that the EPA limit is now. And out of reading those papers, it seemed to me like 3 was probably a good number. I can't say that that's a hard and fast number, but that's how I got them. Reading the other literature from other studies, probably bigger than our studies, and that seemed to show that if you got down to 3, you weren't seeing any these health effects.
So my question is for Dr. Kolak. I think you had the slide up there about the food that's produced for animals and the food that's produced for humans.
Mm-hmm. Food versus feed, yeah.
But humans eat animals.
That's true.
And so is there any research happening about that chain where the animal feed ultimately how it comes into the food? I mean, I'll give you a very brief, because I know you've got your time. So I grew up on a farm where in the 50s, when we were still raising cattle. Now farms are not diversified. They're very stratified now. I'm a Nebraska farmer. But in those days, if we were raising an animal, and my dad would say, oh, that animal foundered, so we need to butcher it quick, which meant the feed, and I would say, well, Daddy, what does that mean? Well, the feed was too hot. Well, only when I grew up did I figure out, oh my God, it meant that they were giving it so many steroids that the thing was bulking up, and guess who got to eat it? All of us ate all the hamburger, off of that animal. And now I realize how crazy that seems. But at the time, it just seemed like, well, that's the thing to do. Well, our animals are still getting a lot of steroids. I mean, chickens aren't. I love it when on chicken packages they say, no antibiotics, no steroids. Sure, because it's been outlawed a long time ago. Go ahead and brag about it. I want to know about studies.
I just wanted to point this out. I picked this up a couple of hours ago because I think it's wonderful, and it's as apropos to Nebraska as it is to Idaho, because as I showed, believe it or not, Idaho, despite the fact that southern Idaho is a desert, we're number either 3, 4, or 5 in dairy production in the country because of Chobani and Tillamook. And I picked this up, right? So if you can't read it, eat beef, the West wasn't won on salad. That's fantastic. I mean, that's just fantastic. That's going on my door of my office. That's wonderful. Yeah, it's great. And your point was very well taken, and you actually, and I mean this in a very positive way, you made about 4 different points, and I think you're kind of making the point that the panel members here are alluding to as well, which is relative to, and I'm trying to be careful in how I say this, but and again, I'm not speaking for the panel members, so if they disagree, I apologize, but to the panel members. But relative to exposure is a nuanced thing, right? And exposure can come down to the, as you just mentioned, the individual animal, right? Not every animal is experiencing their exposure regime is different, and consequently, relative to many lipophilic chemicals, the exposure to humans is also different. I think all of us would agree with what you're saying. I think the point, kind of hearkening back to what Jesse was talking about initially, kind of like taking a step back is, and again, I'm speaking for myself when I say this, but relative to the Water for Food conference, we need to think about food in a more nuanced manner. But in order to do that, we need to start with kind of like, in a way, this sledgehammer approach of what are some large differences that we can look at, pesticide usage on a geographic variation across the country as an example, to kind of illustrate the fact that, yeah, this smoking gun may actually lead to somewhere, so we need to pursue this a little bit more. And I forget which one of the panel members, and then I'll be quiet, but I forget which one of the panel members said this. I think it was Citi, who said that, more research is definitely needed, and this is a cascading effect. But I think one thing that we want to do, particularly relative to the public and public outreach and extension, is recognize that this is not a black hat, white hat kind of situation. We're all on the same team, and we're all looking at maintaining state economies, whether it's Nebraska or Idaho, at the same time maintaining the public health of the residents within those states, because the public health of the residents of those states is the state economy. So we want to basically do all that at the same time. So I apologize if that doesn't directly answer your question, but relative to the Med Center, do you, Ellie?
About No, I don't know of any research directly on that.
All right, a question from online from Sarah Lewis asking, are there examples of regions where they've successfully used this information to work to reduce pesticides within water bodies?
That sounds like it was directed to me, but maybe I'm wrong. Okay. The short answer to that question is no, but the longer answer is the longer answer is relative to the two papers that came out of my postdoc and myself, and the editorial that we wrote in GeoHealth that Ellie and Jesse and Shannon Bartelt Hunt and a number of people from Nebraska Lincoln, the Med Center, was involved in. I damn well hope so in the future. That was the intent. So I think so, yes. One point that I forgot to mention in my talk was I alluded to the fact that there's a dark side to this, and the dark side is that, I'm going to say it because it's true. The dark side is the USGS is considering stopping this database, and I think that would be a major mistake, because I think relative to the questions coming up just in the last 10 minutes, this database is very rich and can be potentially very useful in addressing the kind of questions that we're all talking about. If you're interested in that and you want to do something about it, let me know. I'll give you my card or give me your email and I'll send you. We're putting together a letter that has advocacy, where you do an electronic signature. I will send you that letter. I'll send you the letter. If you don't want to sign it, that's totally fine. But if you want to see the letter, I will send you the letter. And but I think we really want to campaign for keeping that open. Sorry, Jesse. I apologize for monopolizing this. I don't mean to. But relative to that last comment, the very last thing I heard, which was right before I got a pneumonia vaccine about 5 days ago, and it almost killed me. But right before that, not literally, but I was really sick. But right before that, I got an email from the person in USGS, and they said they're relooking at it. So it's kind of, so the website is, and these data are kind of up in the air right now. But so I think a little bit of public pressure could go a long way.
No, and there are other places where, the nitrate issue, for example, in Europe and the Netherlands, that has been a major issue there, and they've been doing a lot of work to try to address this. And you're going to start seeing more, they're literally changing agricultural practices in the Netherlands because of the issues that they are seeing. And so it's not a foreign concept, and there's other examples, but that's just the first one that comes to my mind. Laura, you can please sit down. I'll go run around. Okay, all right.
This was a really great presentation, and I could ask lots of questions, but we don't have time for that. The one question that I did want to ask is, cancer is an illness that has a lot of attention that's brought to it. I mean, probably the most famous cancer patient in the state of Nebraska is Jack Hoffman, the student from Holt High School in Ainsworth. Have any of the cancer advocates been willing to advocate for the kind of work that you're doing?
Yes, I realized after I sat down that I think I didn't show you the acknowledgments slide, but if I had showed it to you, I would have told you, it would have shown you that we had funding from an organization called Sammy's Superheroes, which was founded by Sammy's parents after he had undergone childhood cancer. And I'm actually happy to tell you that, as far as I know, Sammy is alive and well today. His is a successful story. That's one organization that has funded us significantly. We also get funding from the Pediatric Cancer Research Group, which Don Coulter heads at UNMC, and that is funded by the legislature. They are concerned enough about this, have been concerned for years about this high incidence, so they fund that. We also have had smaller amounts of funding from a couple of other smaller advocacy groups for pediatric cancer in Nebraska. So yes, the answer is yes. The pediatric cancer patient families seem to be, they're very motivated about this kind of research because they like the aim that let's see if we can learn why this is happening and get rid of it so that more children don't get pediatric cancer.
Yeah, and we also receive funding from the Clariam Hubbard Foundation as well that helps support a lot of this work. And then also on top of it, cancer is obviously a high profile health issue. But there are other health issues as well. And Dr. Rogan did a good job of illustrating some of those other issues, preterm births, things like that are potentially associated with high nitrate concentration in water. And so, cancer obviously gets the attention, but there are other side health issues that we should also be concerned about and probably spend more time to investigate as well. If we had resources, but you can't do everything.
So just a comment. I think you did a great job putting this session together. I loved how you started talking about the issues in the research and then transitioned to citizen research and then finished with Laura's role of really doing the outreach, which is, I think, a missing component a lot on technical issues. And just a quick question for Laura. Is your role common across Nebraska, across other states? Because I see it as vital.
So specifically focused on water quality and health, no. But like a designated person for just that, I would say no. But when I was talking about extension as a large, folks who work for the university and go out into the public, most states do have that. Nebraska has that, and they cover all 93 counties in Nebraska. But solely focused in on water quality and health, right now it's mostly just...
I think you should lobby for more of it because I see you as the kind of the dot connector with all this, your role.
Yeah.
So my question for Laura is about, so if I was specifically interested in what you were talking about, this program to reach out to the women, and you were talking about your grant is for Nebraska. I mean, you're working on Nebraska, but are you talking about this as a grant that's happening across the United States or just here?
Just
and
here.
then I have a follow-on.
Just here in Nebraska.
Just here in Nebraska. So in many of our communities, especially those, you can tend to follow it, where the slaughterhouses are, is where you have big immigrant populations. And so you'll have a lot of the immigrant women, some speak English and some don't. But is there specifically a component of that then that's trying to reach to those groups of women as well?
Yeah, I think that's why our grant, we haven't gotten too far into it, is because it's so complex. Reaching rural women in general is really difficult because, geographically they're scattered, but also they have a big role at home if they're working and they take care of the, how people say, like, women have multiple jobs, taking care of the kids and all that type of thing. So it's hard to get them together in an evening to come, who wants to come to an educational class about something they don't really know about when they could be, with their children. So it's very difficult, but that's definitely something to consider is reaching different demographics, different people in those areas. Yeah.
Educational materials for.
Yeah, but we were reached out to, someone reached out to us and asked to translate some things into Spanish because that public health department said that they had people who couldn't read it. And so we are definitely willing to accommodate and want to accommodate all the folks that live here in Nebraska.
Laura,
Yep.
the one place, we're out of time, but I'm going to say this anyway. Never get between a academic and a microphone, but the one place that we started to do when I was still here in Nebraska successfully, and Dr. Shannon Bartelt Hunt and City have kind of taken the ball over on this and really pushed it way further than I ever imagined. But the real advantage of doing citizen science is citizen science is approachable to kids, and once you have the kids, you get the moms, right? And it's a way where you can really get to those the females in those communities because you have their kids. I'm going to tell you a really quick story. We were doing our first citizen science campaign. This was about 10, 12 years ago. And we were looking at the entire Elkhorn River all in one day. So we had groups of Boy Scouts out up and down the Elkhorn River sampling for atrazine, nitrate, phosphate with the dipsticks that you saw. There's actually one for atrazine as well. And they were sampling up and down the entire Elkhorn. And I was with one of the groups because my son was one of the Boy Scouts at that time. And we pulled over to the side of the road. They got out. They were sampling in an irrigation ditch. And this truck pulls over, right? And I thought, uh-oh. And this guy gets out, and he's a middle-aged guy, probably about my age, maybe a little younger, and he's in blue jean overalls and boots, and he's got a cowboy hat. And I'm thinking, I'm thinking stereotypically, admittedly, thinking, okay, this could potentially be trouble, and he's going to give us trouble because we're near his land or something. And he came over and he said, "What are you doing?" And I said, we're looking at water. We're doing some water sampling and doing some other stuff. And he started getting a little gruff. And I said, "This is a Boy Scout group." And his eyes lit up like a Christmas tree. And he was like, and he started talking to the kids, and it was a completely different experience. And kids are a gateway. Kids are a gateway to communities. Kids are a gateway to parents. So
I just want to add into that. I think next week, Shannon Bartelt Hunt and I are doing a program there's a program with the Omaha Public Schools with the indigenous Native American students, junior high students, to get them interested in science. And we are doing a water quality. This is the second time we've done it. We did it before the pandemic, and now we're doing another one, getting them interested in this whole issue of water quality with these Native American junior high kids. So.
And we have one last comment from Director Vinton.
Good afternoon. My name's Sherry Vinton. I'm Director of Agriculture for the state of Nebraska. And first of all, I'd like to thank the panel and thank you all for the work you're doing, because I can guarantee you nobody cares more than Nebraska's farmers and ranchers, because the places you're talking about are our homes. I live 5 hours west in the Sandhills, and I am a rancher, so my area was the dot on the map. So, and in my county, cows outdo number people. So I just wanted to thank you very much and let you know that you're talking to a very engaged community that's actually very educated and cares quite a bit. So thank you very much for the opportunity today.
Thank you, Director Vinton. All right, we're going to close it out today. I really appreciate the panelists. I appreciate everybody's participation, and thank you for sticking around. And thank you, Director Vinton, for being here as well. I really appreciate that. All right, well, go have fun. Enjoy the rest of the conference. Thank you.